Marking the 4th anniversary of the healthcare policy dubbed Moon Care, the government unveiled how reinforced health insurance coverage has delivered results so far. With more areas covered by insurance, people did spend less in medical costs, but many tasks lie ahead as ample finances must be procured to further expand coverage.
37 million, or more than 70% of the population, saved 9.2 trillion won in medical expenditures in the past 3 years. This is the government assessment of what has been achieved through the healthcare policy known as Moon Care. Additional fees patients had to pay for a meeting with a doctor of their choice have been abolished. Insurance coverage also applies to charges of upper-class hospital rooms with 2 to 3 occupants. Integrated nursing and care services have been expanded twofold. Other changes over the years include reduced burden of medical expenses for the socially vulnerable, children's hospitalization, and seniors' dementia treatment costs that were shouldered by patients have been almost halved. However, the overall insurance coverage rate is at a standstill in the mid-60% range, while the government target is 70%. The government believes expanding coverage is attainable as related finances remain stable.
중복치료가 일어나지 않도록 예방하고 불법 의료기관에 대해서는 저희가 단속을 강화하면서 또 부당한 급여비 청구에 대한 관리를 강화하는 노력으로.
However, the drop in insurance spending last year was largely due to fewer people visiting hospitals amid the pandemic. The figure may well surge when the outbreak subsides. The law stipulates health insurance programs are funded by government finances, but the execution needs to be more thorough. For instance, this year, 9.5 trillion won to be provided in state support makes up 13% of the insurance fund, far below the statutory 20%. Some experts call for clarity in deciding what areas are subject to coverage in order to prevent unnecessary treatment and fiscal squandering.
를 높이려고만 하다 보면 의료비 규모 자체가 커집니다. 구체적으로 정책별로 필요한 필수성에 따라서 급여권으로 끌어들이면서 본인.
In response, the government said it will further differentiate the diverse medical areas to apply coverage in the most necessary sectors.